Question 1. A 45-year-old male presents with a closed fracture of the shaft of the right tibia and a closed fracture of the shaft of the right fibula, sustained during a skiing accident. The orthopedic surgeon performs open reduction and internal fixation, ORIF, for both fractures. A. 27,759, 27,759 to 59. B. 27,759, 27,758 to 51. C. 27,759, 27,781 to 51. D. 27,758, 27,780 to 59. Answer, C. 27,759, 27,781 to 51. This question tests the coding of multiple closed shaft fractures in the lower leg treated with open reduction and internal fixation. The keyword shaft indicates specific codes for this part of the bone, and open reduction with internal fixation directs to codes for definitive surgical treatment. Code 27759 is for the open treatment of a tibial shaft fracture with internal fixation. The fibula shaft fracture, when treated definitively, is coded separately using 27781 for open treatment with internal fixation. A modifier -51, multiple procedures, is appended to the secondary procedure, 27,781, as per CPT guidelines for reporting multiple procedures performed at the same operative session. Remember, when both the tibia and fibula shaft are fractured and treated definitively, you code each bone separately. Question 2. A 32-year-old patient underwent an arthroscopic meniscectomy of the medial meniscus of the right knee. During the same procedure, the surgeon also performed arthroscopic debridement of a loose body, which required removal from the lateral compartment. A. 29,881. B. 29,881, 29,875 to 51. C. 29,880. D. 29,881, 29,874 to 59. Answer, A. 29,881. This question evaluates the understanding of arthroscopic knee procedures, specifically the bundling of debridement with more extensive repairs or excisions. The keyword arthroscopic meniscectomy leads to code 29881, arthroscopy, knee, surgical, with meniscectomy, semilunar cartilage, medial or lateral. The debridement of a loose body in the same knee is typically considered an integral part of the more extensive surgical arthroscopy and is not separately reportable. CPT guidelines state that diagnostic arthroscopy is not separately reported when a surgical arthroscopy is performed, and many minor associated procedures are bundled. Therefore, only the most comprehensive procedure, the meniscectomy, is coded. Always remember that when performing a surgical arthroscopy, less extensive procedures, like debridement or loose body removal, performed in the same joint, especially in different compartments, are usually inclusive to the primary surgical code unless very specific criteria for separate reporting are met, which are not present here. Question 3. A 68-year-old patient undergoes an open total hip arthroplasty, primary, on the right side due to severe osteoarthritis. A. 27130 RT. B. 27,130. C. 27132 RT. D. 27,132. Answer, B. 27,130. This question tests the correct coding for a total hip arthroplasty, which is a common musculoskeletal procedure. The keywords open total hip arthroplasty, primary, are crucial here. Code 27130 specifically describes arthroplasty, acetabular and proximal femoral prosthetic replacement, total hip arthroplasty, with or without autograft or allograft. This perfectly matches the primary total hip replacement described. Although the patient's laterality, right side, is important for claim submission, CPT codes themselves do not include laterality, which is typically indicated with an anatomical modifier such as RT, but the question is asking for the CPT code itself. Therefore, selecting 27130 accurately reflects the surgical procedure performed. Always look for the most specific code that describes the entire procedure without being overly complex, and remember that laterality modifiers are added during the billing process, not typically part of the base CPT code description itself. Question 4. A patient is diagnosed with a ganglion cyst on the dorsum of the left wrist. The surgeon performs an open excision of the ganglion cyst. A. 25111 LT. B. 25112 LT. C. 25110 LT. D. 25115 LT. Answer, C. 25110 LT. This question assesses the coder's ability to identify the correct CPT code for the excision of a common soft tissue mass. The keywords ganglion cyst and open excision point directly to a code describing the removal of this specific type of cyst. Code 25110 is designated for excision, lesion of tendon sheath, or capsule, e.g., ganglion cyst, wrist, dorsal or volar, primary. The location, dorsum of the left wrist, confirms this choice. Code 25111 is for a secondary excision, and 25112 is for a complicated or recurrent ganglion, which is not stated in the scenario. Remember that the code should precisely match the procedure and location, and be sure to check for any indicators of complexity or recurrence that might lead to a different code. Question 5. A 7-year-old patient falls from a tree, sustaining a closed displaced supracondylar fracture of the humerus. The physician performs a closed reduction with percutaneous skeletal fixation. A. 24,538. B. 24,535. C. 24,545. D. 24,530. Answer, A. 24,538. This question focuses on coding a pediatric fracture with a specific type of reduction and fixation. The critical keywords are closed displaced supracondylar fracture of the humerus, closed reduction, and percutaneous skeletal fixation. Code 24538 describes closed treatment of supracondylar or transcondylar fracture, humerus, with or without intercondylar extension, with percutaneous skeletal fixation. This code accurately reflects the technique used for reduction and fixation. Code 24535 is for closed reduction without fixation, and 24545 is for open reduction. Always ensure the chosen code precisely matches the fracture type, location, and the method of treatment, closed, open, with or without fixation. Question 6. A patient presents with chronic osteomyelitis of the calcaneus, heel bone, and undergoes a partial ostectomy, excising a portion of the infected bone. A. 28,120. B. 28,100. C. 28,122. D. 28,124. Answer, A. 28,120. This question tests the coding of bone excisions for chronic infection in a specific foot bone. The critical keywords are chronic osteomyelitis, calcaneus, heel bone, and partial ostectomy, meaning partial bone excision. Code 28120 is the correct choice, as it is specifically defined for partial excision, craterization, saucerization, or diaphysectomy, bone, e.g., osteomyelitis or other infection, talus or calcaneus. This code directly matches the procedure on the calcaneus. Code 28122 applies to other tarsal or metatarsal bones, but not the talus or calcaneus, emphasizing the importance of precise anatomical location. Always double-check the specific bone mentioned in the operative report to select the most accurate code within the bone excision series. Question 7. A 55-year-old patient undergoes an arthroscopic subacromial decompression with acromioplasty and bursectomy of the shoulder. A. 29,826. B. 29,822. C. 29,823. D. 29,827. Answer: A. 29,826. This question tests knowledge of arthroscopic shoulder procedures and their associated bundling rules. The keywords arthroscopic subacromial decompression, acromioplasty, and bursectomy point to a comprehensive procedure. Code 29826 describes arthroscopy, shoulder, surgical, decompression of subacromial space with partial acromioplasty, with or without coracoacromial release. This code includes the bursectomy as an integral part of the decompression, meaning it is not separately reported. Codes like 29822, debridement, and 29,823, debridement extensive, are for less involved debridement procedures and would not be used when a definitive repair like an acromioplasty is performed. When coding arthroscopic shoulder procedures, always look for the most extensive procedure performed, as it often encompasses less significant related procedures. Question 8. A surgeon performs a closed treatment of a coccygeal fracture, fracture of the tailbone, without manipulation. A. 27,200. B. 27,202. C. 27,201. D. 27,205. Answer: A. 27,200. This question focuses on the coding of fracture treatment, specifically for the coccyx, without manipulation. The keywords closed treatment, coccygeal fracture, and without manipulation are crucial. Code 27200 is used for closed treatment of coccygeal fracture. This code implies treatment without manipulation, as a separate code, 27201, exists for closed treatment with manipulation. Code 27202 describes open treatment, which is not applicable here. Therefore, the simple closed treatment without manipulation correctly corresponds to 27,200. Remember to always distinguish between codes that include manipulation versus those that do not when coding fracture treatments. Question 9. A patient requires removal of internal fixation devices, plates and screws, from a previously fractured right tibia and fibula, which were treated years ago. The hardware is located in the tibia shaft. A. 20680 RT. B. 20670 RT. C. 20,680, 20,670 to 59. D. 27,724. Answer: A. 20680 RT. This question tests the coding for the removal of deeply embedded internal fixation hardware. The keywords removal of internal fixation devices, previously fractured right tibia and fibula, and hardware is located in the tibia shaft indicate the need for a code for deep hardware removal. Code 20680 is for removal of implant, deep, e.g., buried wire, pin, screw, metal band, nail, rod, or plate. Since the hardware is in the tibia shaft and was for a prior fracture, it is considered deep. Code 20670 is for superficial implants, which does not apply here. The fracture of the fibula previously treated with the tibia does not change the coding for removal of hardware only from the tibia, as described. Always differentiate between superficial and deep implant removal and choose the code that reflects the depth and complexity of the removal. Question 10. A 40-year-old patient presents with Dupuytren's contracture of the right hand involving the ring finger. The surgeon performs a fasciectomy of the palmar fascia, excising the diseased tissue. A. 26123 RT. B. 26121 RT. C. 26125 RT. D. 26040 RT. Answer. A. 26123 RT. This question focuses on coding surgical treatment for Dupuytren's contracture. The key phrases are Dupuytren's contracture, fasciectomy of the palmar fascia, and ring finger, which specifies a single digit. Code 26123 is specifically for fasciectomy, palmar only, with or without Z-plasty, other local tissue rearrangement, or skin grafting, each digit affected, or part of hand, with release of finger joint contracture, metacarpophalangeal joint, proximal interphalangeal joint, or both. This code is appropriate for a fasciectomy affecting a single digit. Code 26121 describes a more extensive procedure involving the entire hand, palmar fascia. Remember that Dupuytren's fasciectomy codes are often categorized by the number of digits or parts of the hand affected, so pay close attention to the operative report details. Question 11. A 60-year-old patient undergoes a revision of a total knee arthroplasty, involving the removal of the femoral component and insertion of a new femoral component, as well as removal of the tibial component and insertion of a new tibial component. There was also extensive debridement of bone cement from both the femoral and tibial sides. A. 27,486. B. 27,487. C. 27,488. D. 27,487, 27,486 to 51. Answer. B. 27,487. This question tests the coding for a complex revision total knee arthroplasty. The keywords revision of a total knee arthroplasty, removal of femoral component and insertion of new femoral component, and removal of tibial component and insertion of new tibial component clearly indicate a two-component revision. Code 27487 is specifically for revision of total knee arthroplasty, with or without allograft, femoral and tibial components. The extensive debridement of bone cement is considered an integral part of this complex revision and is not separately reported. Code 27486 is for revision of one component, and 27488 is for a revision with a major tibial defect requiring a graft. Always look for the single code that encompasses all components revised in an arthroplasty, as it usually bundles associated work like debridement or cement removal. Question 12. A patient with severe osteoarthritis of the ankle undergoes an open arthrodesis, fusion, of the ankle joint. A. 27,870. B. 27,871. C. 28,715. D. 27,880. Answer. A. 27,870. This question assesses the correct coding for ankle fusion. The key terms are osteoarthritis of the ankle and open arthrodesis, fusion, of the ankle joint. Code 27870 precisely describes arthrodesis, ankle joint, open. This code is used for the surgical fusion of the joint to relieve pain and stabilize it. Code 27871 refers to an arthrodesis of the tibiofibular joint, which is a different anatomical location. Code 28715 is for a subtalar fusion, also a different joint. When coding fusions, it is crucial to identify the specific joint being fused and the surgical approach, open or arthroscopic, though ankle fusion is typically open. Question 13. A 28-year-old patient presents with a displaced fracture of the left lateral malleolus. The physician performs a closed reduction with internal fixation. A. 27786 LT. B. 27792 LT. C. 27810 LT. D. 27814 LT. Answer, B. 27792 LT. This question tests the coding of a specific ankle fracture treated with internal fixation following a closed reduction. The keywords displaced fracture of the left lateral malleolus and closed reduction with internal fixation are crucial. While the reduction itself was described as closed, the application of internal fixation typically requires an incision for device placement, which CPT often categorizes under open treatment codes for fractures, especially when a specific percutaneous fixation code is not available. Code 27792 describes open treatment of distal fibular fracture, lateral malleolus, with or without internal or external fixation, which encompasses the use of internal fixation for this type of fracture. Therefore, even with a closed reduction approach, the use of internal fixation generally leads to an open treatment code in the absence of a distinct percutaneous fixation code. Always understand that open treatment in CPT can include scenarios where an incision is made for internal fixation, even if the fracture was initially reduced closed. Question 14. A 70-year-old patient undergoes percutaneous vertebroplasty, with injection of bone cement, on a single thoracic vertebral body. A. 22,510. B. 22,511. C. 22,512. D. 22,514. Answer. A. 22,510. This question tests the coding for a specific minimally invasive spinal procedure. The keywords are percutaneous vertebroplasty, injection of bone cement, and single thoracic vertebral body. Code 22510 is used for percutaneous vertebroplasty, bone biopsy included prior to cement injection, one vertebral body, unilateral or bilateral injection, thoracic. This code perfectly matches the procedure described for a single thoracic vertebra. Code 22511 is for a lumbar vertebral body, and 22512 is for sacral, while 22514 is for additional vertebral bodies. Always ensure that the anatomical location, thoracic, lumbar, sacral, and the number of vertebral bodies treated match the chosen code for vertebroplasty. Question 15. A patient presents with a benign soft tissue tumor measuring 2.5 cm on the forearm. The surgeon performs an excision of the tumor. A. 25,065. B. 25,075. C. 25,071. D. 25,076. Answer, D. 25,076. This question tests the coding for excision of soft tissue tumors based on size and location. The critical information is benign soft tissue tumor, 2.5 cm, and forearm. Codes for excision of benign tumors in the musculoskeletal section are typically organized by location and size. For the forearm, codes 25,071 to 25,078 are relevant. Code 25076 describes excision, tumor, soft tissue of forearm or wrist, subcutaneous, less than 3 cm. Since the tumor is 2.5 cm, it falls into the less than 3 cm category. Code 25075 is for intramuscular, and 25071 is for radical resection. Always pay close attention to the tumor's size, depth, subcutaneous versus deep/intramuscular, and location when selecting the correct excision code. Question 16. A 50-year-old patient sustains an open fracture of the tibia shaft, type 2 Gustello-Anderson classification. The surgeon performs an open reduction and internal fixation of the tibia shaft fracture, with extensive debridement of contaminated tissue and bone fragments. A. 27,759. B. 27,759, 11,011. C. 27,759, 11,012 to 59. D. 27,759, 11,010 to 59. Answer, C. 27,759, 11,012 to 59. This question combines fracture care with wound debridement in the context of an open fracture. The keywords are open fracture of the tibia shaft, open reduction and internal fixation, ORIF, and extensive debridement of contaminated tissue and bone fragments. Code 27759 is for open treatment of tibial shaft fracture, with or without internal or external fixation. For the debridement, since it's extensive and involves contaminated tissue and bone fragments for an open fracture, Code 11012, debridement including removal of foreign material associated with open fracture, S, and or dislocation, S, skin, subcutaneous tissue, muscle, and bone, is appropriate. The CPT guidelines specifically allow for reporting debridement of an open fracture, 11010-11012, in addition to the definitive fracture repair, 27759, using modifier -59 to indicate that it is a distinct procedure from the fracture repair. Remember to always consider reporting separate debridement codes when performed for open fractures with significant contamination. Question 17. A patient undergoes an arthroscopic repair of a torn anterior cruciate ligament, ACL, using an autograft from the patient's own patellar tendon. A. 29,888. B. 29,889. C. 29,880. D. 29,882. Answer, A. 29,888. This question tests the coding of a common arthroscopic knee ligament repair. The crucial keywords are arthroscopic repair, torn anterior cruciate ligament, ACL, and autograft from the patient's own patellar tendon. Code 29888 is specifically for arthroscopically aided anterior cruciate ligament repair/augmentation or reconstruction. This code is designed for the repair or reconstruction of the ACL using arthroscopic techniques, regardless of the type of graft, autograft or allograft, as long as it's not a primary repair without augmentation. Codes 29880, 29882, and 29,889 are for other knee arthroscopy procedures, such as meniscectomy or posterior cruciate ligament repair. Always ensure the chosen code clearly specifies the ligament being repaired and the arthroscopic approach. Question 18. A surgeon performs a total shoulder arthroplasty, primary, for severe degenerative joint disease. A. 23,470. B. 23,472. C. 23,395. D. 23,473. Answer, B. 23,472. This question focuses on coding a primary shoulder replacement. The keywords total shoulder arthroplasty, primary and severe degenerative joint disease are crucial. Code 23472 specifically describes arthroplasty, glenohumeral joint, total shoulder, glenoid and proximal humeral replacement, e.g., total shoulder arthroplasty. This code perfectly matches the primary total shoulder replacement described. Code 23470 is for a hemiarthroplasty, partial replacement, and 23473 is for a revision procedure. Always carefully distinguish between partial, hemiarthroplasty, and total replacements, as well as primary versus revision procedures, when coding arthroplasties. Question 19. A patient presents with a severe comminuted fracture of the olecranon, part of the ulna at the elbow, requiring open reduction and internal fixation. A. 24,675. B. 24,685. C. 24,665. D. 24,670. Answer, B. 24,685. This question tests the coding for a specific fracture in the elbow region treated with open reduction. The keywords are severe comminuted fracture of the olecranon and open reduction and internal fixation. The olecranon is part of the ulna. Code 24685 is for open treatment of olecranon fracture, with or without internal or external fixation. This code precisely matches the open surgical repair of an olecranon fracture with internal fixation. Code 24675 is for closed treatment with manipulation, while 24665 is for closed treatment without manipulation. Remember to always select the fracture code that accurately reflects the anatomical location, fracture type, and the method of definitive treatment, open or closed, with or without fixation. Question 20. A patient undergoes an arthroscopic partial synovectomy of the knee, limited to the lateral compartment. A. 29,875. B. 29,876. C. 29,877. D. 29,870. Answer, B. 29,876. This question assesses the proper coding for an arthroscopic knee synovectomy. The keywords arthroscopic partial synovectomy of the knee and limited to the lateral compartment are essential. Code 29876 is for arthroscopy, knee, surgical, synovectomy, partial, separate procedure. This code is used when a synovectomy is performed in one compartment. If the synovectomy were extensive or in multiple compartments, 29877 would be used. Code 29875 is for removal of a loose body, and 29870 is for diagnostic arthroscopy. When coding arthroscopic synovectomies, differentiate between partial and extensive, and note if it's performed in one or multiple compartments. Question 21. A 6-month-old infant is diagnosed with congenital clubfoot. The orthopedic surgeon performs serial casting and manipulation in the office. This is the initial treatment session. A. 29,450. B. 29,450, 20,690. C. 29,065. D. 29,010. Answer, D. 29,010. This question tests the coding for initial casting and manipulation for congenital clubfoot. The keywords 6-month-old infant, congenital clubfoot, serial casting and manipulation, and initial treatment session are important. Code 29010 is specifically for application of Risser jacket, localizer, body cast or Minerva jacket, or serial casting, for clubfoot. This code covers the application of serial casts, which often involves manipulation for clubfoot correction. Code 29450 is a general code for application of a short leg cast, not specific to clubfoot treatment. Remember that initial treatment of congenital conditions like clubfoot often has specific codes that bundle both manipulation and casting. Question 22. A patient undergoes a complete tenodesis of the biceps tendon at the shoulder using an open approach. A. 23,410. B. 23,430. C. 23,415. D. 23,420. Answer B. 23,430. This question specifically asks for the code for a biceps tendon procedure at the shoulder. The keywords complete tenodesis, biceps tendon, shoulder, and open approach are crucial. Code 23430 is the correct choice, as it describes tenoplasty, biceps tendon, with or without tenodesis, open. This code directly addresses the surgical repair involving tenodesis of the biceps tendon performed via an open technique. Codes such as 23410, 23412, and 23,420 are related to rotator cuff repairs, which is a different structure. Always ensure the chosen code precisely matches the specific tendon and the type of repair or procedure performed. Question 23. A patient undergoes an initial application of a short leg cast for a non-displaced fracture of the distal tibia. This is performed in the emergency department by the ED physician. A. 29,405. B. 29,405, 99,024. C. 29,425. D. 29,435. Answer A. 29,405. This question tests the coding for initial cast application, specifically a short leg cast. The keywords are initial application, short leg cast, non-displaced fracture of the distal tibia, and performed in the emergency department. Code 29405 is for application of short leg cast, below knee to toes. This code is for the initial application of the cast. While the fracture management might be part of a global period if the orthopedic surgeon takes over, for the ED physician performing only the initial cast, 29405 is correct. Modifier -54 or -55 would apply if the cast application was part of a global fracture treatment. However, as presented, it's just about the cast application itself. Remember that initial cast applications have specific CPT codes and are distinct from subsequent cast changes or fracture repair codes. Question 24. A surgeon performs an open repair of a nonunion of the right clavicle, utilizing an autogenous bone graft harvested from the iliac crest through a separate incision. A. 23,515. B. 23,515, 20,902 to 59. C. 23,515, 20,900 to 59. D. 23,510, 20,902 to 59. Answer B. 23,515, 20,902 to 59. This question involves coding for a non-union fracture repair with bone grafting. The crucial keywords are open repair, non-union of the right clavicle, and autogenous bone graft harvested from the iliac crest through a separate incision. Code 23515 is for open treatment of clavicular fracture, with or without internal or external fixation, with or without bone graft. This code covers the repair of the clavicle non-union. Since an autogenous, from the patient, bone graft was harvested from the iliac crest via a separate incision, code 20902, bone graft, any locale, autogenous or allogenous, by separate incision, e.g., rib, iliac crest, etc., is reported separately. Modifier -59 is appended to 20,902 to indicate that the graft harvesting is a distinct procedural service from the clavicle repair. Always remember to separately report autogenous bone graft harvesting from a separate incision when coding fracture repairs. Question 25. A patient undergoes an open fasciotomy for chronic exertional compartment syndrome of the anterior compartment of the lower leg. A. 27,600. B. 27,601. C. 27,602. D. 27,603. Answer, C. 27,602. This question focuses on coding a fasciotomy for compartment syndrome. The key phrases are open fasciotomy, chronic exertional compartment syndrome, and anterior compartment of the lower leg. Code 27602 is the correct choice, describing fasciotomy, leg or ankle, compartment syndrome, multiple compartments, or fasciotomy, leg or ankle, compartment syndrome, one compartment. This code is used for a single compartment fasciotomy for compartment syndrome. Code 27600 is for an incision only for drainage, and 27601 is for decompression with deep fascia incision. The phrase anterior compartment confirms it is a single compartment, leading directly to 27,602. When coding for fasciotomies due to compartment syndrome, carefully distinguish between single or multiple compartments and whether it's acute or chronic.